It's getting really bad.
Nearly everyone I know has like a nightmare story. People being turned away, people spending days in the emergency room.
Every company that's involved in providing healthcare has made record profits through the entire pandemic while we're still dying. It's not just that we live in poverty amongst plenty, it's that our poverty provided them the plenty.
You already know the healthcare system in this country is fundamentally broken, but there is something that if you live in a major city, you might not understand or know about. And that is the problem with rural healthcare. You know, with most other things, you're going to see a higher density of something in a city than you would in a rural area. That just kind of makes sense. But it really should be different when we're talking about healthcare, because that's something everybody needs and often needs to survive. But unfortunately, a large portion of the rural population in this country are in what's called healthcare deserts. And you've probably heard that term deserts when applied to food, because there's been a ton of data mapping showing that in many rural areas and even some urban areas, they lack access to grocery stores. So people have to rely on prepackaged food and processed food from convenience stores or other stores just to eat, or have to rely on fast food or other alternatives. And that's not healthy in the long run. But the same thing is happening with healthcare. Just look at some of these charts. 9% of counties in this country are primary care deserts. And that's where those people don't have sufficient access to a primary care physician. And 9% of counties may not seem like a lot in the grand scheme of things, but that is literally millions of people in this country who don't have sufficient access to a primary care physician. That's something you should have. That is your first entry point into the healthcare system, and it's great for preventative care. But over 20% of counties, and that's millions and millions of people, don't have sufficient access to hospitals. Now that is deeply troubling, because what if something extremely bad happens? What are you going to do? Your only resort is to go an hour, two, maybe even more to the nearest hospital instead of having one nearby, which you should have. Because for so many instances, the speed and delivery of care could help mitigate long-term consequences or even worse outcomes. So this is really, really troubling. Of course, it's because of how our healthcare system operates. Healthcare companies that are driven by a profit motive don't really have a financial incentive to set up shop in rural areas because there's a lower population density. And that's a disservice to everybody who lives there because they're treated as secondhand citizens compared to somebody who lives in a high density population area. That's not fair. Everybody should be treated equally, especially in healthcare. And as you know, that profit motive in our healthcare system leads to a wide array of problems. For some people, it's high costs. It's being denied coverage. It is being denied your claim. It is spiraling into medical debt and sometimes bankruptcy. But for people in these counties, it's all of those issues and also their hospitals closing. We've seen around 20 rural hospitals close since the start of the pandemic. That's a global healthcare crisis, and 20 or so hospitals in rural areas closed in the United States. It's because these companies wanted to make more money, so they just cut off some of these costs. That is so backward. Hospitals should not be profit centers. Hospitals are a lifeline for people in emergencies. But because we don't have a Medicare for all system, we don't have a universal care system, we have a for-profit private care system, this is the outcome we're going to see, and it's only going to get worse because they're going to continue to want to make more and more money to enrich their executives and their investors, but that comes at your expense because they don't care about you. They only care about their bottom line.